When watching pornography, the brain and body can undergo several changes and responses. Here are some of the possible effects. Increased dopamine release. Dopamine is a neurotransmitter in the brain that is involved in feelings of pleasure, motivation, and reward. When a person watches pornography, it can trigger the release of dopamine in the brain, leading to feelings of pleasure and reward. This can create a positive reinforcement loop, where the brain learns to associate watching pornography with pleasure and seeks out this behavior in the future. However, over time, this can lead to a decrease in the sensitivity of dopamine receptors, making it harder to experience pleasure from other activities and potentially leading to addiction or dependence on pornography. Activation of the reward system. The reward system in the brain is a group of neural circuits that are involved in the regulation of motivation, pleasure, and reward. When a person watches pornography, it can activate the reward system in the brain, leading to feelings of pleasure and satisfaction. The activation of the reward system can reinforce the behavior of watching pornography and lead to a desire to seek out the same experience again in the future. However, over time, repeated activation of the reward system can lead to desensitization and a need for more intense or novel stimuli to achieve the same level of pleasure, potentially leading to compulsive or addictive behavior. Increased heart rate and blood pressure. Watching pornography can lead to increased heart rate and blood pressure, similar to the way they might increase during other types of sexual arousal. This is because sexual arousal triggers the sympathetic nervous system, which is responsible for the fight or flight response. This response increases blood flow to the muscles, including those in the genital area, and can cause an increase in heart rate and blood pressure. However, it's worth noting that the degree to which heart rate and blood pressure increase can vary widely from person to person and may depend on factors such as the type of pornography being watched and the individual's underlying cardiovascular health. Sexual arousal. Watching pornography can lead to sexual arousal, including increased genital blood flow and lubrication in women and erection in men. This response occurs due to the activation of the brain's sexual response cycle, which is responsible for regulating sexual desire, arousal, and orgasm. When a person watches pornography, it can trigger the brain's sexual response cycle and lead to physiological changes in the body, such as increased blood flow to the genitals and the release of sex hormones. However, it's important to note that not all individuals will experience sexual arousal in response to pornography, and the degree of arousal can vary widely from person to person. Additionally, repeated exposure to pornography can lead to desensitization, which can decrease the degree of sexual arousal experienced in response to this type of stimulus. Changes in brain activity. Studies have shown that watching pornography can lead to changes in brain activity, particularly in areas associated with reward, motivation, and visual processing. Specifically, research has shown that viewing sexual stimuli, including pornography, can lead to increased activation in the brain's reward circuitry, including the ventral striatum, anterior cingulate cortex, and orbitofrontal cortex. These brain regions are involved in regulating the experience of pleasure and reward. In addition, watching pornography can lead to changes in visual processing, including increased activation in areas of the brain involved in visual attention and processing, such as the occipital cortex and fusiform gyrus. This heightened visual processing may be related to the intense visual nature of pornography. It's worth noting that the precise changes in brain activity that occur in response to watching pornography can vary widely depending on factors such as the individual's age, sex, and level of sexual experience, as well as the specific content of the pornography being viewed. Desensitization. Over time, repeated exposure to pornography can lead to desensitization, where an individual may require more intense or novel sexual stimuli to achieve the same level of arousal. This desensitization can occur due to the brain's natural process of habituation, where repeated exposure to a stimulus leads to a decrease in the brain's response to that stimulus over time. In the case of pornography, repeated exposure to similar sexual stimuli can lead to a decrease in the brain's response to that type of content, requiring individuals to seek out more novel or intense sexual stimuli to achieve the same level of arousal. This desensitization can lead to negative effects, including decreased sexual satisfaction, difficulties achieving arousal or orgasm with a partner, and potential addiction or dependence on pornography. It's worth noting that not all individuals who view pornography will experience desensitization, and the extent of the desensitization can depend on factors such as the individual's frequency and duration of use, as well as the specific type of pornography being viewed. It's important to note that the effects of watching porn can vary widely from person to person, and not all individuals will experience the same responses. Additionally, the impact of pornography on an individual's mental and physical health can depend on factors such as frequency of use, personal beliefs and values, and underlying mental health conditions. Watching pornography can sometimes lead to relationship problems, particularly if one partner feels uncomfortable with the other partner's pornography use or if the pornography use interferes with the couple's sexual or emotional intimacy. Some potential relationship problems associated with pornography use include decreased sexual intimacy. If one partner is spending a significant amount of time watching pornography, it may decrease the amount of time or desire they have for sexual activity with their partner. Decreased emotional intimacy. Watching pornography can sometimes lead to decreased emotional intimacy between partners, particularly if one partner feels that their partner's use of pornography is a betrayal or a sign that they are not emotionally available. Jealousy or insecurity. If one partner feels that their partner's pornography use is a threat to the relationship or feels jealous or insecure about the content of the pornography, it can lead to relationship problems. Communication breakdown. If partners are not communicating openly and honestly about their feelings and attitudes towards pornography, it can lead to misunderstandings, hurt feelings, and ultimately, a breakdown in communication. It's worth noting that not all couples will experience relationship problems associated with pornography use, and some couples may even find that watching pornography together can enhance their sexual intimacy. However, if one partner feels uncomfortable with the other partner's use of pornography, it's important to communicate openly and honestly about their feelings and work together to find a solution that works for both partners. Ethical and moral concerns. Some individuals may have ethical or moral concerns about watching pornography, particularly if they feel that it objectifies or exploits women or if they believe that it contributes to a culture of sexual violence. Some common ethical and moral concerns associated with pornography include objectification and exploitation of women. Some individuals believe that pornography contributes to the objectification and exploitation of women, and that it perpetuates harmful gender stereotypes. Normalization of violence and abuse. Some individuals believe that pornography can normalize or even promote violence and abuse, particularly towards women and marginalized groups. Negative impact on society. Some individuals believe that pornography has a negative impact on society as a whole, contributing to social and cultural problems such as sexual violence, addiction, and mental health issues. Violation of personal values and beliefs. Some individuals may have personal values or beliefs that are in conflict with watching pornography, and may feel that it goes against their moral or religious principles. It's worth noting that there is ongoing debate and disagreement around the ethical and moral implications of pornography use, and that individuals may have different perspectives and beliefs on this topic. It's important for individuals to engage in critical thinking and reflection when considering the ethical and moral implications of their own pornography use, and to seek out resources and support if they have concerns or questions. Comments your thoughts and views. Please subscribe and like.